Well, let's find out what's happening with health services now. They've been severely affected by the ongoing violent protests across the country. Some doctors describing the situation as a war zone. In KZN, several clinics had to close. In Joburg, a 6-month-old baby was reportedly shot in the head at a clinic in Hillbrow with rubber bullets during the looting today. In the middle of all of this, we're still battling the third wave of the pandemic, Gauteng accounting for over half of the infections. Well, we're joined now by the Acting Deputy Director General for Hospital Services at the Gauteng Health Department, Dr. Frederick Hongwana. Also joining us, the Life Healthcare CEO, Peter Wharton-Hood. Good evening to you both, gentlemen. Dr. Hongwana, if I may just start with you. Good evening. Are you able to tell me how full your hospitals are tonight because of the protests that we've seen in Gauteng and because of the COVID-19 virus?
Good evening, colleague. We having a lot of pressure in Helen Joseph, and the fact that that impacted on the Ratanda CHC, the Hillbrow CHC, which has been heavily affected, Edenvale Hospital. So it is a tragedy that we have these riots in the midst of the pandemic. But a number of our hospitals are still having pressure as a result of the COVID-19. However, we have capacity in terms of beds, particularly the ones that are in our alternative building technologies, the infrastructure that was constructed last year. We've got 5 of those facilities that are currently functional, and we have more capacity in those. In terms of outcomes of care, we really don't need these riots. It's very painful. It is interfering with the supply of our oxygen tankers, and we're hoping that the South African Police Services will come in place to make sure that our tankers that supply oxygen are not impeded, so that we can have assurance confirmed of the security of oxygen supply in our facilities. We are monitoring our beds every day. We're using technology. We've got the COVID-19 bed management tool that tells us of the various hospitals that where we are in terms of pressure. And the biggest pressure is in ICU and high care. Our general wards, we still have beds available. But we're using a risk-adjusted and demand-informed strategy, and we depend and we defer to experts on the ground. We call our hospital functional business units, where the CEOs and the clinical team and the management on the ground will make clinical decisions and clinical governance decisions to repurpose beds within the hospital in order to combat COVID-19. The Gauteng Department of Health has got about 18,000 beds. And remember, we are not the Department of COVID-19, we're a Department of Health. And these beds are our resources that we have been using before COVID. And with COVID, we have added close to about 1,425 beds because of the alternative building technologies. And that's how we needed to optimize those beds. But we are monitoring it on a daily basis using our dashboard. We're getting reports from all our institutions. We're monitoring security of oxygen, monitoring security of PPEs, monitoring security of clean laundry. And that we do daily. We have a 12 o'clock daily meeting Monday to Sunday to make sure that we monitor and respond very, very, very quickly. Yes, we are under pressure. That we cannot deny. The peak has been higher. The reports that we got today from epidemiologists that we're coming down, and we have a 14% decrease within compared to the past 7 days. That's a good news. But however, we still have to be very careful for the next 2 to 3 weeks, so that we don't drop the ball. And one of the tragedies with these riots is that they are becoming, that's our fear, they're becoming super spreaders, where people do not follow the rules of, mask, sanitizing, don't be congregate, social distances. So that really is alarming. But also the impedance of resources that we need that is to be delivered to our hospitals it's something that keeps us on our edge. So we are monitoring the situation on a regular basis. We will be getting reports now at 7 o'clock in the evening, tomorrow in the morning, so that we can report to our principal to make appropriate actions. We are in touch with the South African Police Services. And we're looking forward to the announcement of the President tonight as to what will be the next step in containing this tragedy of these riots. That's giving us more headache and heartache.
That's the situation in the government hospitals in Gauteng tonight. Peter Wharton-Hood, you're the CEO of Life Healthcare. Is the situation very similar to you? Are your institutions full, both in KZN and Gauteng?
Yes, as the doctor reported, we have a similar set of circumstances, but perhaps exacerbated by the fact that we don't have spare beds. So the riots, more specifically in KZN, have caused absolute havoc in our hospital and care processes. We had to get a police escort for our oxygen replenishment truck to get to our hospital. 60 nurses couldn't make work at Westville. We've had night shift care workers who had to now sleep in the hospital or arrange alternative accommodation for them. We haven't got enough people manning our kitchens. We haven't got enough people in the laundry. So the practical consequences of delivering care to sick people has now been compromised by the selfish actions of the rioters. Of course, we do everything that's possible. We are in bilateral contact between the hospitals in the region, and the local management teams have the decision rights to make every necessary step to ensure the continuity of care. But one can imagine that our healthcare workers have been under pressure for the best part of 18 months in dealing with the pandemic, and that was an unavoidable set of circumstances. The riot situation is an avoidable set of circumstances. And we've just placed the very care workers who are trying to get us out of the COVID pandemic at severe personal risk. They're at risk every day when they come to work. Now they're at risk getting to work, and in some instances can't even get to work. So we're in a desperate set of circumstances which will have to depend on the resilience of our healthcare workers. The cooperation between government and private remains of paramount importance, and we'll keep making the correct decisions to take care of our patients. But you will understand that certain of these things are very, very difficult, and the circumstances are now in a unique set for all our healthcare workers.
I mean, Dr. Kongwana, I mean, the risk, of course, I mean, you listen to Peter Wharton-Hood here, and I can see you nodding, very difficult to provide proper care. The risk, of course, is that people might lose their lives just because there's too much pressure on the healthcare system through no fault of a nurse, of a doctor, of an institution, of a system, just because there's too much pressure.
We need peace in our land, and one hopes very strongly that our law enforcement agencies will get this tragedy of the riots to a stop very quickly, because yes, we share the same space with my colleague from Life, that it is impeding the brave healthcare workers from actually coming to the hospitals to take care of the patients. I mean, imagine impeding the transportation of oxygen, which we need, is the biggest commodity we need, it's the biggest asset we need to deal with this respiratory condition. So it's just not right. It's just unfair. It's unacceptable. It just boggles the mind. It hurts. Fundamentally, it hurts.
It's incredible that this is happening. Dr. Wharton-Hood, I mean, you must be very concerned for your patients, for the people that you're caring for, when you have all of these problems.
Patient care is our number one priority in Life Healthcare. And we've now got to balance that with the safety, the physical safety of our healthcare workers. There's only so much pressure that systems can take. And the impassioned plea to our nation was, please behave responsibly. As Doctor pointed out, socially responsible behavior, wear the mask, social distance, sanitize. Let's try and flatten the curve and get the pandemic under control. Those were the instructions of last week. Compound this now with irresponsible behavior that's putting our whole healthcare system at risk. I agree with Doctor, it boggles the mind, and it's time for responsible actions to get the riots under control so we can get back to looking after sick people and making sure that our healthcare workers are safe in getting to work and returning home in the evenings as well.
Peter?
How a society can expect healthcare workers to go that far and beyond? It's difficult to understand. It's time for peace and it's time for responsible behavior.
Peter Wharton-Hood, the CEO of Life Healthcare, Dr. Freddie Kongwana, Acting Deputy Director General for Hospital Services in the Gauteng Health Department. Thank you both very much indeed for the time. I really do appreciate it.